and we're very excited to have Dr. Alex with us this evening. She works very closely with Dr. Caitlin, and just another one of the team members up from our friends in Woodbury, Minnesota from the Wellness Way. So very, very important topic. I taught class this afternoon, and yes, it came up a lot, and that was not even our topic. But we're excited to get started here. In fact, you know what I'm going to do is I'm going to have her share all of her expertise. So I'm going to stop sharing, and then she can kind of take it from here.
Yeah, so I'm really excited to be here. Inflammation is a huge, huge topic for me specifically. Really, inflammation in general is going to be the root cause for every disease on the planet, and we're going to go really, really in depth on that. But when I was a lot younger, and my brother got really sick and no one could figure out what was wrong with him. And it turns out went to a chiropractor, and after a bunch of testing by medical doctors, couldn't figure out what was wrong with him. And after going to a chiropractor and a couple of adjustments and addressing his root cause of inflammation, that's exactly where he found his healing journey. So that is where kind of my passion for inflammation comes from, is from real family change. And that made me go through chiropractic school. I went to undergraduate school at Loyola University in Chicago, stayed in that Chicago area for my chiropractic degree, and then went on to do additional certifications in active release technique and figuring out all the tools that I could have in my toolbox to make sure that I was helping out patients as absolute best that I could. All right. So, Sandy, do you want me to start sharing my screen?
Yep, absolutely.
Awesome. All right. So, looks like here. Perfect. I'm going to go to this slideshow for you. All right. Can everybody see?
Yes.
Perfect. Okay. So the Wellness Way and our approach to inflammation is going to be a little bit different than your traditional approach. And everybody on here, it's so awesome because I feel like we all have a very like-minded community when we're talking about doTERRA, when we are talking about really identifying root cause to inflammation and root cause to disease in general. So our approach to inflammation is going to be based off of really getting to that root cause. All right, so we're going to kind of jump in on just a couple of quick case studies that walked through our door at the Wellness Way and the change that we saw by addressing inflammation itself. So this is Wendy, and these are going to be pictures of portions of her intestines. So she went into the doctor because she was having bleeding every single time that she went to the bathroom. And when she was having all of this bleeding, she would go to the doctor and they would put her on a medication. So after 3 or 4 times of the gastroenterologist changing her medications, he was like, I'm really sorry to tell you, but there's nothing else that we can do for you other than, removing your intestines and getting you a colonoscopy bag. Because if you look at these pictures, you see that there are going to be huge amounts of red inflammation. You're seeing yellow pus. All of this is signs of infection and inflammation that is going on within Wendy's system. Now, Wendy had 5 boys. She's in her mid-30s. And she was like, there's absolutely no way that I can go through life with a colonoscopy bag that I can, a colostomy bag that I can play with them, that I can run around with them. My kids want to hug me. I want to make sure that I can, maintain intimacy with my husband. And those were really, really, really important things that she wanted to basically go into. I need a second opinion. This can't be my only option. So with Wendy, we did a variety of different testing on her. She brought in these pictures, and after testing, We made sure to address her signs of inflammation. We did food allergy testing on her, which if you've been on here before, Dr. Caitlin has probably talked about food allergy testing, testing the gut system to see, how is your body breaking down fats, proteins? Where are signs of inflammation? Is there immune system stress? So bacteria, parasites, yeast overgrowth. All of those different things are going to be things that we tested in Wendy. And after she went through identifying those stressors, identifying those triggers, if you notice here, this is healthy tissue, light pink. There's no signs of that pus or yellow, nasty pus kind of going on, no big red inflammation, and all of that swelling went down. So this is going to be the images that her gastroenterologist actually took, walked out, showed them to her and said, you know what, I guess you actually don't need that surgery after all. And before, that was her only option. So this is really, I think, one of my favorite ways that we've addressed inflammation, and it changed someone's whole life. Now, medicine has actually come out to say that the secret killer, the surprising link between inflammation, heart attacks, cancer, Alzheimer's, really the root cause to any disease. And all of us over here, and maybe even in the doTERRA realm, if they saw this Times magazine, then you were like, this wasn't a surprise. Inflammation is the root cause to everything. So we need to make sure that we're not just diagnosing people, but that we're really identifying inflammation and what that trigger or that stressor could actually be. So that's why we have what's called the fireman carpenter principle. So when we have new patients come into the office, we have people that walk in and they whisper and they're like, I'm taking these medications. And medications aren't necessarily a bad word. So that's where we really go into the fireman and carpenter principle to say, hey, there is a time and a place for medicine, but maybe we're not quite there yet. So let's do some testing and figure it out to see how we can support the body. So when you have a house that's on fire, let's say, you guys get off of this call and you go out, your kitchen's on fire and it's absolutely nothing that a fire extinguisher can put out. Who are you going to call? You're going to call the fire department. Why? Because that's their job. They put out those fires so that your house doesn't become just a pile of embers at the end of the day. So in order to save the structure, they're going to spray it down with hose. They're going to go in with their axe to get through the window, to get through the doors. And if you think about it, that's the same thing that medicine does with medications. They're going to constantly just spray down that fire to try to keep it from getting big again. Or they're going to go in with their axe or their surgical tools to really see what they can do as far as removing something or changing the structure of something. Now, if you can't live in that house anymore, so let's say, again, they've come in, they've sprayed down the house. Well, now there's all this toxin buildup. The walls are caving in, the roof is caving in. You're going to turn to that fireman and say, oh, we have grad parties this week. It's that time of the year. I really need you to fix my house now. Well, the fireman's going to laugh at you because that's not their job. They're going to say, you need to call someone else. And that's really where we compare ourselves to medicine. Medicine is going to be that emergency. You have a heart attack, stroke, something that's happening right now, and you need to make sure that you save yourself so that you can make it to another day. That's going to be that fireman and how we, again, view medicine. So it has a time and a place. But in order to keep yourself from either getting on fire, or if you've been on fire and you need help rebuilding, you need that carpenter doctor approach. You need someone that understands how all of the units really tie together and how you can really support whatever inflammation is going on within your body. So our approach is always saying that we rebuild what fires have destroyed. We test to identify what triggered the fire in the first place and identify potential future fires to hopefully keep them from happening or keep them from happening to that extent in the future. So again, more of the carpenter approach. And one of the best ways that we can really highlight this is through high blood pressure. So if I have high blood pressure, and let's say Dr. Caitlin has high blood pressure, but they give us the exact same medication, can you tell me that we 100% have the same cause for why we have high blood pressure in the first place? No, because everybody is entirely different. So the medical approach is going to say, hey, you have high blood pressure. Here is a medication, a calcium channel blocker, ACE inhibitor, Lasix, something to go ahead and put that fire out, if you will. Because can you die from high blood pressure? Yes, it could be an emergency situation. So we need to make sure that we are figuring out, though, why it's happening in the first place. And then you're going to have more of an alternative medicine approach or a functional medicine approach where they're like, well, I don't want to take all those medications. So I'll take fish oils, B12s, CoQ10, magnesium, potassium, things that, yes, are very, very good for you and don't have as many side effects as a medication. But when is the end date on those supplements if you don't figure out why your blood pressure was high in the first place? So again, that's how we view ourselves different from medicine. We do all the different testing that we have, whether it's a Dutch test, whether it's a thyroid with hormone test, whether it's a food allergy test, a gut test. We need to figure out what is triggering that high blood pressure in the first place so that we can actually identify what caused it. We can definitely support you along the way into handling the current high blood pressure, but we also need to figure out what caused it in the first place at the same time so that we actually can address the issue. So if you go to a medical doctor and you have high blood pressure, what are they going to tell you? They're going to tell you to take their medication and to live a healthy life. But what is health? And most of you, if you wanted to put it in the comments on what is health, you definitely can. And you're going to find that a lot of you are going to have the same answers. So you're going to notice that I can probably predict them. Nutrition. Eat a really clean diet. Maybe you'll throw in organic foods, staying away from processed foods, but really focusing on a whole food, anti-inflammatory diet. And then some of you are probably going to chime in and say, make sure that you work out. Make sure that you are lifting weights and running, making sure that you walk, maybe going swimming. And then, of course, make sure that you have enough sleep. So sleeping 7 to 8 hours. These are the 3 most common things that we see. But if this was entirely true, and these are the only things that made you healthy and reduced inflammation in your body, then each one of us would very easily be able to get rid of whatever disease or symptom that we had. So that can't possibly be all that there is to health. So then I don't know if you guys have ever seen this movie with Grandpa Gustafson, where he talks all about how in the morning he wakes up and he eats bacon. And then for lunch, he eats a whole plate of bacon. And then later for dinner, he eats bacon and he smokes all day and he drinks his beer at night. And all of his friends that never smoked, never drank, and watched everything that they ate died, and he's still living. So what makes one person able to have really, really bad habits and another person can do the exact same thing and struggle with weight, struggle with joint pain, struggle with skin issues, struggle with not being able to sleep? So it can't just be merely related to those 3 things. So the World Health Organization is going to come up with definitions, because here we're all about testing and never guessing. So making sure that we always test, we don't guess with people's health, but then also making sure that we can define exactly what we're looking for, exactly what we're doing. So health, classified by the World Health Organization, would be a state of optimal physical, mental, and social well-being, and not merely just the absence of disease or infirmities. So we would tell people that we actually like this definition because it's talking about optimal function and not just the absence of disease. But Webster's actually is going to be one of our very, very favorites, where health is actually a condition of wholeness to which all the organ systems are functioning 100% of the time. So then what is the most important organ system that we support? A lot of people would say your heart. But when we look at this picture here, we see that the brain is actually going to be what we talk about here. So can you replace your heart if you have heart damage? Yes. Can you replace your lungs if you need new lungs? Absolutely. Those aren't good things that you have to go through, but you can. But you can never replace your brain. Your brain is connected to your spinal cord, and that is how your body talks from your brain out to the rest of your body, and vice versa, the rest of your body back to your brain. So it's super important that we're making sure that we support the nervous system and making sure that that connection is as reduced in inflammation as possible. And these are going to be two people, they're probably the most famous that people are aware of when we're starting to talk about nervous system damage and what nervous system inflammation and damage can do. So Christopher Reeves and Dale Earnhardt were both in terrible, terrible accidents where their lungs, their respiratory system, their nervous system, their spinal columns were involved, and it ultimately led to their death. So can damage to your nervous system kill you? It absolutely can. So it's really important to make sure that we're supporting that communication from the brain to the rest of your body. And how do we do that? Well, as chiropractors, so that's going to be one of the main things that I wanted to make sure when I told you that story about my brother, I wanted to make sure that I understood, how did she change his nervous system? How did he change it so that that severe pain went away when no other doctor could? So that's when we start to talk about identifying the different areas that can cause inflammation in the body. So what damages your nervous system are traumas, toxins, and thoughts. And we call these things the 3 T's. So as a chiropractor, for a minute, I'm going to talk again a little bit more about trauma, because we're going to think of that as a physical stress, physical inflammation on the body. And this starts from day one. Everybody wants to view birth as this super, super beautiful process, which it is, it's a miracle. But in today's world, it's traumatic. It's traumatic on mom when C-sections are at an all-time high, when we're cutting through layers and layers of tissue, and then mom is left through, maybe 24 hours, 48 hours in a hospital if there's no complications, and getting an ibuprofen when she leaves, but she just cut through every layer of tissue that she had to get to that baby. So that's super traumatic. That's going to cause a rise in inflammation. Then talking about baby. So baby on day 1 is often in a vaginal birth. There's forceps used, vacuums, and then not to mention that if there is a C-section, baby is often just kind of pulled out. However, when the birth canal has a very, very real function in how it actually prepares baby to enter the world, clear lungs, and all of those extra details. So on both hands, birth from day 1 is a huge inflammatory process. So that trauma then just goes on into day-to-day life where we work all day and we're hunched over like this in our chairs looking at our computers or down at our phones. We put kids into schools where they're carrying around 30 to 40 pound backpacks. And we get into car accidents, or we're stuck in traffic all day and we're sitting constantly. We're not getting that mobilization, or maybe you have a sports injury. So all of those different things are going to be physical areas of inflammation and stress on the body. So then we talk about, why is it so important to see a chiropractor? So there's a lot of different kinds of adjustments, you guys. There's so many different kinds. It's not all just popping and cracking, but really what a chiropractor does is they look at that nervous system starting with the neck. So again, your brain communicates to the rest of your body through that spinal cord, and that spinal cord runs through your spine, and you want it to optimally be a soft C-shaped curve. So this green line right here. Now, when it's not a soft C-shaped curve, you can kind of picture it like a rubber band, where if it's soft, it has this nice C-shaped curve, but if you stretch it out, there's all that extra tension, right? So that's going to put inflammation on that nervous system and how the brain communicates with the rest of your body through that spinal cord. But oftentimes when we're looking at x-rays as chiropractors, or maybe you've been told by your doctor, oh, well, that disc degeneration in your neck or your back or wherever, that's all just related to age. So then we actually have something on this slide that's going to really kind of go against that statement a little bit. Does it become more common over time? Yes, but that doesn't mean that it's normal. So when we're looking at phase 1, you're seeing super, super straight as far as that spinal column there. And in between each one of those, let's see if I can get my mouse here. So in between each one of these bones here is a disc, and you want these discs to be super, super big and fluffy because that's going to keep these bones from getting close together and aggravating different nerves and causing degeneration. But then you get to phase 2, and you see that over time, there's still this really big disc here. But if you notice here, super, super skinny, and there's even cracks there. But if it's age-related, I want to ask you, is this disc any younger than this disc in the same spine? No. So it can't just be an age-related fallback that we go to. It means that there was a physical trauma, physical stress and pressure that happened at this joint, and it was there for a long time. So it's not the age's fault, but the trauma's fault. So we need to make sure that we're addressing that through those chiropractic either adjustments or manual therapy. So one of the techniques that I mentioned being certified in is active release technique. Not everybody wants to get their neck cracked. I get that. It could be scary to hear those popping noises. It could be scary to get that adjustment. But there are going to be ways where one, Dr. Caitlin, she adjusts with what is called an integrator. So very much more of a gentle approach, but just as effective. I do a diversified technique, so a manual adjustment where you may hear some popping and cracking sounds. But then you also are going to have manual therapy or muscle work that you can do to mobilize those joints. That's going to be where that ART or that active release technique really comes into play when I'm seeing my patients. But how can we also address trauma through different support when we see that there's inflammation on testing, when we see elevated inflammatory markers? Well, some supplements that we might use at the Wellness Way for some of this physical trauma might be turmeric, chamomile, boswellia, also known as like a frankincense, liver glandular, vitamin D3K2. But all of those things are going to be dependent on testing. So what are going to also be some really great things that you can incorporate from doTERRA? Deep Blue, Past Tense, Rescuer, Copaiba, frankincense. And all of them have a little bit of a niche to them, which is absolutely beautiful. So Deep Blue, I know that I've used this a lot with people that get into car accidents that have chronic aches and pains from fibromyalgia, whiplash, same as Rescuer. That's going to be a really nice one that I have a lot of people that I recommend getting on in a roll-on form. So it really just kind of depends what kind of physical stress you're having, because if it's more headache related or migraines, that cervical or that neck tension and those neck muscles, Past Tense is amazing. Copaiba is wonderful. If you're getting headaches from like the cold and the flu, so it's a little bit more maybe around the fall and winter when we start to see people more getting their shoulders super uptight because it's cold outside up in Minnesota, shivering, shoveling the snow, and then they get sick. Copaiba is awesome. So it really just depends on making sure that you are in tune with yourself to know what kind of physical trauma that you're going through, and always reaching out for that extra doTERRA support from Sandy or Kayla, because they are awesome for that. And when you come into the Wellness Way in Woodbury, our office really likes to make sure that we can answer those questions for you too. But there are going to be different kind of stressors on the body. So when we are looking at the nervous system, we want to make sure that we're viewing all those organ systems functioning together. And that's why we have the Swiss watch principle, because we view the body as acting as a Swiss watch. You can't take out one of those little gears or one of those little organ systems and think that your body's going to function normally. So we have to make sure that through the testing that we do, and again, everybody's totally different. Not everybody gets the same recommendations because no two people are the same. So when we make those recommendations, we want to make sure that we're identifying where those stressors or those inflammatory stressors could be. And when we view these things in medicine, something that I like to tell my patients is, okay, if you go to a heart doctor, if you think you have a cholesterol issue or heart palpitations and you go to the heart doctor and they check your circulatory system, but the issue was somewhere else, so then eventually you start having some stomach pains, and every time you go to the bathroom, there's something wrong. It's never consistent. Maybe you can't go for several days, or you go multiple times a day, and now it's interfering with everyday life. Maybe you have acid reflux, and you go to a gastroenterologist or a digestive system doctor. Well, do you think that that cardiologist and that gastroenterologist ever really talk to each other? Probably not. So it's really hard for them to connect the pieces. And quite honestly, most of the time they don't speak the same language. So again, that's why we make sure that we do recommend the testing that we do to make sure that we're really getting to the root of those inflammatory symptoms that someone could be happening. So what effect does trauma, toxicity, and thoughts have on all of the different organ systems in the body? So this is where we really go into toxins a little bit more. We are exposed to toxins every single day. And some things we can control and some things we can't. So when we're using household cleaners that are awful, 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 and I know that in this community, there are so many great options for those different cleaners, things that you can make at home. But then you have to think about the makeup that you put on your face. What is really in those ingredients? Are you breathing in air pollution? Again, not something that we can necessarily control all the time, but is it leading to allergies? So then do we have to address, okay, how can we support that body and that inflammatory response to air pollutants? So we need to support that respiratory system, respiratory inflammation. And then of course, heavy metals. If there is silver in your mouth, it is likely that you are getting heavy metal exposure every single time that you eat something, drink something, and breathe in. But then we also have to think about our food, you guys, because food can be one of the most toxic things that people are putting into their body these days. And Nutri-Grain was once thought to be the most nutritious breakfast food that you could give your kids. And I mean, I grew up in a house where I ate this almost every morning. And my mom thought that she was making a good choice. And why did she think that? Because down at the bottom here, the American Diabetes Association supports this bar. Well, why do you think that is? Look at all of these different types of sugar, corn syrup, high fructose corn syrup, fructose, sugar itself, and then you have additional food dyes like Red 40, Blue 1. All of these different things are going to add up to toxic exposure in your body. So we need to make sure that we're able to really support the body as best we can. And one of the best ways that we can really do that is focusing on, what there used to actually be no organic foods. It was just food. So that's going to be one of my favorite things that I tell my patients. And I understand that when you are going to the grocery store, organic can get really, really expensive, but we need to make sure that we are reducing the amount of toxins in our body. And one of the best ways to do that is by looking at the Dirty Dozen. Those are going to be the foods that are highest in pesticides, highest in chemical sprays to them, things that are really holding on to all of those different toxins that people put into their body that lead to inflammation. So making sure that when you can, if you can choose organic versions of the Dirty Dozen, that's going to be my first start. Let's focus there on that dirty dozen and choosing those to be the organic ones that we go for. Now, the clean 15 is going to be the foods that had the least amount. So that's an area where if you do have to choose for you or your family, these are going to be the areas where I would say, hey, that clean 15 has the least amount of that toxic exposure through the different testing that they do. So these ones are going to be good ways to go if you need to make those choices between them. Some key ingredients to avoid, though, when you are looking at your food is all of these different things here: soy proteins, palm oils, vegetable oils, high fructose corn syrup, MSG, aspartame. All of those are going to be things that you can avoid by looking at food labels, and that itself is really going to reduce the inflammatory items that you're putting into your body when you're making those different choices. So when we're starting to talk about foods, that's when I really try to hone in on a couple more reasons why it's so important to get food allergies tested, because this is Allison. Allison came in with headaches, PMS, gut issues, constantly breaking out from acne, and she was always focused on making really, really healthy food choices. She was like, I don't know what I'm doing. I do an anti-inflammatory diet. I eat tons of salads, tons of vegetables, and I cannot get rid of these symptoms. So with a food allergy test, in addition to a gut test, we went ahead and found out that Allison had 23 IgG food reactions. So this is going to be a type of food allergy. It's not a sensitivity, it's an allergy. So an IgE response is typically what people think of when they think allergy. E, think emergency. You eat a peanut, your throat swells up, you might need an EpiPen. It's an instant anaphylactic, possibly life-threatening reaction, but it only activates 1% of your immune system. The rest of your immune system is still a huge, huge component. IgGs activate 70 to 80% of your immune system, and it's a delayed response. So you could eat a food, a very healthy food, and react anywhere from 30 minutes after you eat that food all the way up to 30 days after you eat a food. So it's going to be really hard to figure out what was the inflammatory food in the first place that caused an immune system response, but it could have also been a very, very healthy food. So when we look at Allison's list, she's allergic to broccoli, Brussels sprouts, cabbage, eggs, goat milk, tomatoes, walnuts. These are all things that are very healthy that she was eating day in and day out, thinking that she was making really healthy food choices. But the good thing about IgG reactions is that they can actually change with proper addressing of inflammation within the gut. So that's exactly what we did with Allison, tested her gut, and after we supported that gut, she went down to 9 food allergies, and almost all of her symptoms were gone. So again, this is going to really stress why it's so important to know that yes, you could be making really healthy choices and trying to address inflammation, but if you're not seeing the success, this is where, again, I say, hey, let's not guess anymore. Let's go ahead and test and make sure to just cut out the middle guy and make sure that you're making the best choices to reduce inflammation. And then we have Mark. So Mark actually, he was taking over 20 supplements. His wife worked at a supplement store. So he, again, was taking every sort of skin supplement related something that you could find. He had a laundry list of things going on. And he was a salesman, and it got to the point where it actually started to affect their family's income because he couldn't shake anybody's hand. He would walk in and either it would be so painful and he would just try to hide it, or it would get so bad that he was actually embarrassed to even present his hand in the first place. So if you see on the left-hand side of your screen, it's inflamed. His fingers are all swollen up. It's pussy. It's starting to look a little crusty, even scabbed over. And after we did gut testing and food allergy testing, his hands were what they were on the right. He was no longer reliant on steroid creams, and he knew exactly which supplements his body needed. And eventually, he was able to reduce down his supplements to minimal supplements to just get him through the day with a good glandular as a multivitamin and some vitamin D, which is all that he needed after that. So what are great ways to support your body with toxins? Again, we always recommend testing, but some of the go-tos that we have for different reasons are Albizia. Albizia is incredible for food allergies. Nettle's wonderful with environmental allergies. Rehmannia is wonderful as an anti-inflammatory as well. Digestion glandular is great for gut inflammation and supporting that rebuilding of different gut enzymes. Colloidal silver, vitamin D3, K2, all of these things could be appropriate for you, but always recommending testing before taking any of these supplements. And then for doTERRA, On Guard, awesome for first of all, I don't know about everybody on here, but Minnesota has terrible air quality right now from some of the fires that were going on in Canada. So air pollution is huge for us here. But in today's age, we have so many factories in the cities, things like that. It's absolutely amazing. Mold, it's wonderful for mold. We have a lot of patients with mold. Purify for all sorts of different allergies, great for bug bites. Cinnamon bark and tea tree. I mean, tea tree, you could go on and on and on forever about. We absolutely love tea tree and all of the different ways that it can support the body with different toxic infections that could be going on. But especially for the women on here, people often undermine how important it is to really take care of stress. Stress can make you sicker than anything else, especially as a woman, okay? It can disrupt hormones, estrogens, thyroid hormone. It can impact the way that you sleep, the way that your gut is digesting food, absorbing vitamins, minerals, and nutrients. So it's super, super important to make sure that we don't put mental, emotional stress on the back burner. So that's where we go into the third T, which is thoughts. So stress, when people think of stress, they're like, oh, well, you know, I'm not really stressed. It's fine. I just have 4 kids, a full-time job, and a huge backyard, and all my kids are in different sports. One of my kids is going to be getting engaged soon. So they're like, but it's fine though, because that's normal for me. Well, that doesn't mean it's not stress. Even getting engaged, that could be a really fun time, super exciting for both the person and family, but it's still stress. And your body doesn't know good stress from bad stress. It just knows stress. It's the same response. So it's really important to make sure that we really understand where that stress is coming from, which is why we go super in depth with our patients on what could be going on in work, at home. All of those different things are super important. And that's going to bring us to Derek. So Derek is a 35-year-old man, came in with low testosterone. He already knew he had low testosterone. He went to his medical doctor, and him and his wife had just gotten married, and they were planning to have a family, and they weren't getting anywhere. So they went to a medical doctor, and they got his testosterone tested, and they said, you know what, it's fine. If you look down here at the bottom, the range is 348 to 1,197. That is a huge range. So how can you tell me that someone at 300 is just as healthy as someone that's at 1,100? There is an optimal range. So in order to have proper function, we needed to figure out why Derek was having such low testosterone and not just supply him with more testosterone or have him, recommend going to a medical doctor to get testosterone replacements. We needed to make sure that we really figured out why his testosterone was low. So after we went through his different testing, we found out that he was having a huge blood sugar issue. Okay, so his blood sugars were super high. What does sugar do? Sugar gets in the way of how testosterone is converted. So we needed to make sure that he went on a no sugar diet. He was weightlifting, he fasted, and after a while, him and his wife came back to one of their consultations after coming in for a couple months and already started to notice a difference. And a couple months after that, they actually came in, told us that they were pregnant, and they've since then had 2 kids. So all that he needed was a little bit of that support in addressing why was his testosterone low in the first place. All right, and then we're gonna go to Miss Cheryl. So Cheryl this is what a Dutch test looks like. So this is gonna be how we start to look at hormones. So we can measure hormones in the blood, but a Dutch test is measuring them in the urine. So looking at how urine is going to look at how the body processed hormones to get them out of your body and which pathways they went down. So her estrogens were all super, super low, but we needed to figure out why. And if we looked at her stress hormone, her cortisol was through the roof. So we had to dive in a little bit deeper with her though. She's 60 years old. We needed to figure out, yes, she's in menopause, but her hormones should be a lot more balanced than this. And her stress was through the roof. Found out that this time 5 years ago, she had lost the love of her life. And her children were just recently getting really fed up that she was so tired, that she was cranky all the time, that she had no drive to do anything. And they were really pushing her to start dating again. She wasn't ready for it. What did Cheryl need? Cheryl needed to address that mental stress. And what we did is we, of course, supported her in that stress response and that stress inflammation that she was experiencing. But ultimately, she needed to work that out with a therapist. So this is going to be something where, again, we can work hand in hand with other people because there are so many tools that people need in order to address what's going on. But there are things that we can do for stress. So I know, at least for myself, I will go towards chocolate. And there is a reason. Your body physically wants you to crave chocolate because cacao is going to be super, super high in all of the happy hormones, epicatechins, tryptophans, release of oxytocin, and it's the #1 source of magnesium. And that's going to be super, super important when we are talking about how to build all those happy hormones. So there is a reason, and I'm giving you the excuse to eat a good source of chocolate. So feel good about that. And then there's a lot of different ways to get a good source of chocolate. Now, if you do Hershey's, Ghirardelli, Lindt, all of those have no nutritional value to them. They've killed all of the goodness that comes from real organic cacao. So always choosing a really good brand and looking at the source is going to be awesome. And of course, if you need help, we're always here to help with that. So when we are addressing inflammation regarding thoughts, stress, at the Wellness Way, there's a lot of different kinds that you can do, but kava is a great option, California poppy, ashwagandha, bacopa, and a good adrenal glandular. But everybody's so different. If you have really high cortisol, some of these are more appropriate. If you have really low cortisol and you're just tanked because your body has been so stressed for so long, there are other ones that we would recommend. So again, that testing is super important. And then, of course, with doTERRA, there are so many great ones, but Peace and Serenity are beautiful blends trying to, depending on which area you're going for, whether it's stress, anxious, worried, or whether it's more high strung, anger, anxiety, ADHD, kind of calming down some of that stress on the nervous system. But bergamot and lavender are great options as well. So a couple quick things here. So before someone came in, they were having all sorts of different digestive issues. And we can see here, there's x-rays. And these x-rays show signs of gut inflammation. And that's actually a test that we do on day 1. So when you come in, if you come in person for a new patient appointment, we do x-rays because we, as chiropractors, we look at the spine, but we also want to make sure that we're looking for signs of soft tissue inflammation. This gives us a really good idea when we're seeing this amount of gut inflammation, there's something going on within that gut. And again, we don't like to do any guessing, so we need to get a gut test or a stool test to figure out what is actually happening in that gut. Is there a parasite? Is there bacteria overgrowth? Is there bad bacteria present? We don't want to do any guessing. And then, of course, support the body. This is an after we addressed the signs of inflammation going on via those tests. You can tell those bubbles are far. There's still a couple little here, but other than that, so much relief. And at this point, this patient wasn't really feeling too many symptoms anymore, but we still needed to make sure that we addressed those. And this is Liam. I don't know if Dr. Caitlin has shared this with you. This is Dr. Caitlin's son. So he came in as a 3-year-old that was nonverbal autistic. So he wouldn't talk. He had terrible bladder control at that time. Dr. Caitlin had tried everything, and this was prior to her becoming a doctor and was one of the reasons why she got into the Wellness Way in the first place, because they brought Liam here after trying a dairy-free, gluten-free, paleo, everything that they could think of, went to every doctor that they could, and everybody just told them, well, Liam just has autism and this is just, what it's going to be. Well, they made sure that, again, just kind of like Wendy at the beginning, that they didn't settle for that. They wanted a second opinion and they ended up at the Wellness Way. And this was his gut test. So this is a Genova test that I've been talking about. You can see on this side, these are good bacteria, but they are so overgrown. We want this to be nice and balanced. On this side, they're super high. So addressing food allergies, addressing gut inflammation, he went from all of those to only 6 overgrowths. So at this point, when they retested, he had started to talk. He was able to go to church groups. He was able to play with his brothers when before he was just interested in playing by himself. So this was a huge, huge influence on Dr. Caitlin getting where she is today. And it's so important to see that there can be true change, even in kids, when it seems like there's no other option and you just have to kind of settle. That's not true. We need to make sure that we're figuring out what could be triggering inflammation. So building blocks after getting testing, doTERRA offers absolutely incredible products. Obviously, just making sure that you're getting tested to see which one is most appropriate for you and the different digestive concerns that you might have. But whether it be through digestion, fiber support, probiotic support, greens support, there's so many different things that doTERRA offers that's absolutely incredible. But these are some of the supplements that I often would make sure people have access to. So we talked about copaiba, deep blue, frankincense, turmeric. Turmeric is going to be, we have turmeric as well, one of our most potent anti-inflammatory tinctures that we have. And doTERRA has it as well. And then, of course, essential oils. There's going to be some of those in the same forms outside of supplements. So you have copaiba, eucalyptus, frankincense, and then that rescuer as well. So just some things to kind of point out. Copaiba could be great for arthritis, muscle cramps, sore throat, even some respiratory, but honestly, eucalyptus I think is incredible for when we were talking about thoughts and stress. That's a really great one to have diffusing, but it's great for respiratory issues as well. Boswellia or frankincense, which I chatted a little bit about earlier too. Frankincense can be great for, again, more of like depression, anxiety. It can be really, really great for, and wound healing as well when we're starting to think of some of that extra support. And then MetaPower Collagen. Collagen is incredible. As a chiropractor, thinking about joint health, connective tissue health, collagen is absolutely so important to look at. So of course, this one has lemon and orange flavoring. So testing for food allergies, but at the same time, absolutely incredible. There is nothing like a really good collagen. And you can tell when you haven't had your collagen in a while, if you're really getting those anti-inflammatory benefits to your joints, you can feel it. So you can feel the difference truly in taking some of these supplements, using these essential oils, whether it's diffusing it in the air, putting it in a good oil base to apply on your body. There's some incredible literature that doTERRA has if you don't have it on what those mixtures can be. And I would be happy to help you out there as well as you come in. I'd be more than happy to incorporate those recommendations for you. So we talked about all of the 3 different stressors that we really like to go into when we are looking for different sources of inflammation within the body. So, of course, we would love to extend a little bit of love to our doTERRA friends. We're offering a $99 new patient appointment. All you have to do is mention doTERRA, and you don't have to be from the Woodbury area. Of course, if you're near us, we would love to get you in and see you face-to-face. I'd love to see you face-to-face for that in-person appointment. Dr. Caitlin would as well. We would do a full thorough history, an exam, get you some x-rays to look for that sign of soft tissue inflammation, and look at how your joints and your spine are all functioning together. And then that's when we would recommend the next steps. But some of you I saw had all those really super summery temperatures going on in California and tons of other places. We can do virtual appointments as well with Dr. Jen. Dr. Jen does all of our virtual appointments, and she is absolutely incredible, and she's going to be one of the people that helped support Liam when Dr. Caitlin was a patient herself for her family. So all of us are absolutely in love with doTERRA, and we would love to support you on your journey, answer your questions along the way to see how we can use both of them together. So if you have any questions, let me know.
Thank you so much, Dr. Alex. I'm going to bring up the finishing slides. Please submit your questions and we'll get those answered as well. All right, if you haven't already, please join the Discover Essentials Facebook group. This is where the recording will be posted, and also it will be sent in your inbox if you're part of the Discover Essentials email list. So bit.ly/email list. DE stands for Discover Essentials. Please join those today so that you know what's going on. I would recommend going to the right first. Check your progress toward graduation. Grad Progress 2025. It is case sensitive. So either click, take your cameras, do the QR code, or type that in and save it so that you can then register for tonight. Please, within the next hour, register for tonight's class. There is a permanent library with an abundance of education in there as well. I would highly recommend that you look into that and share it with others as well. This is just a few of the gifts. So here it's either this or a teachable course. Personally, do I like oils? I love them. But a $97 teachable course, absolutely. And get that education, as doTERRA is so known for that. We want to keep on top of things. So definitely 2 of these if you're graduating tonight. Make sure you include which ones that you'd like. 3 ways for people to purchase them: retail, wholesale, and below. Of course, you're going to find these in professional settings, the retail, but who wouldn't love to offer anybody that we come in contact with that's willing to listen to what we learned tonight and share those products with them at below. So you will see here, these are just a few of the kits. And again, I would minimally, if not monthly, check what you have in your stash, what's in your inventory, and order a kit instead of just a few of these, and give these away and share them. Great gifts, graduation, wedding showers, you name it. Here is some more. She talked about the wellness bundle and the deep blue. So this is a great one to get started with. And here is the Natural Solutions kit. Keep this in mind. These are, look at the savings, $364, all below wholesale when you purchase the kit. So keep that in mind. And again, if you're new, whoever invited you to tonight's class, make sure that you share some of these great ideas here. We want to thank you so much for joining us. Enjoy doTERRA's wonderful oil, a true gift of the earth. My contact information is down below. And you can email me or text me, call me, whatever works best for you. I'm going to stop sharing, and you'll see in the images where the chat is what the giveaway is for this evening. And before we stop recording, Dr. Alex, I'm sorry.
I wish.
4 to 109. Pick a number, and Kayla will announce that in the chat.
44.
All right, she will come up with that. So the first question, did you see those there?
Yes.
I think Elaine's might have been the first one. Is that a safe protocol?
Recording stopped.
Yeah, so I think when we were talking about fruits and veggies, I always wash all of mine, whether they're organic or not, and I use water. I tend to use apple cider vinegar, but again, I don't have an apple allergy, so white distilled vinegar is going to be a great option if you haven't had that tested. That's going to be one of the best combinations there, and then adding the lemon oil can be really wonderful as well. So I think, and then it looks like a couple people liked that comment as well, kind of answering Elaine's question a little bit for me. But as far as the dilution there, I would just recommend making sure that you're using enough water, but the 5 drops should be fine. Let's see here. Gail, wow, the list, she's allergic to beans. Yeah. What's good for glyphosate? So I saw that there was also another question about glyphosate later as well. So I think one of the most important things that you can do in regards to glyphosate is going to be really eliminating what you can and choosing organic when you can. Another thing that you can do is it's going to be really hard to control and know exactly what glyphosates are on or different chemicals, pesticides, things like that. It's going to be really difficult to know 100%. So what do you need to do is we need to see, and we would recommend testing because again, we don't want to guess at all. How is your liver functioning? How is your kidney functioning? Or your kidneys functioning? So when you're looking at those organ systems, those are going to be major detox organs. So we need to make sure that your body is able to really help support you through getting rid of that as much as you can. Now, another place that you want to make sure that you're supporting is your gut. So the Genova gut test that we use actually will tell us if you are recycling toxins. So there's going to be a marker in there that we can look at and see, are you actually recycling toxins or getting rid of them every time that you do have a bowel movement? So it's super important to get those values tested. But as from there, that's then when we would make those different recommendations on how to best support your body into getting to supporting you through that. Let's see here. How do you get?
Somebody's asking how you can get tested.
Yep. So how you get tested. So the best way to start getting tested is to use your discount. So use that $99 promotion that we do only for our doTERRA right now. And just mention that. That's going to get you to that new patient appointment. At that new patient appointment, first of all, if you go online and you see that there's some testing and you're like, yes, that's what I've been looking for, let us know because we are a cash based. So meaning that we don't take insurance. Why don't we take insurance? Is going to be because if we take insurance, then we have to do exactly what they tell us to, and we can't test any other markers without charging you an arm and a leg. So one of our tests, let's say, sometimes people will come in and have to get that test. They bring it to their medical doctor because they want to use their insurance, but there's not a drug, medication, or surgery that's going to treat those different values. So then they're left with a giant bill, and we don't want that for you. So always recommend coming into that new patient appointment where we can go over what tests are actually going to be the best recommendation for you right now. And then that's how we get you started, and we'll give you all of the tools on how to do that. If you're in Woodbury, we draw blood right in our office. The famous Dr. Caitlin does our blood draws here, so you'll see her face as well in that scene, and she'll draw the blood and we'll get it sent off to the labs. If you are not local to the Woodbury area, we'll ship that to you and we will find that blood draw location near you. So again, we want to make sure that we're not putting any extra inflammation or stress on your body. We'll do all that work for you. You don't need to worry about it. So the first step is scheduling that new patient appointment, and that's how we'll get to the appropriate testing for you. Kayla said, Albizia is effective, but doesn't taste the greatest. So our liquid herbs, Kayla's not lying. So our liquid herbs are just that herb extracted with alcohol and water. So, and the reason for that is we make them liquid so that they can be as potent as possible. As soon as you put them into your mouth, they start getting into your bloodstream within seconds. So that's how you're going to really bypass getting it past your digestive system so that you don't lose any of that potency. Our tinctures, our supplements are very potent, but because of that, they don't taste the greatest. But we'll help you through that. We have tips and tricks along the way for you too. So Valerie, how do you detox from glyphosate? We kind of talked about that. Just making sure that you know exactly where that inflammation could be coming from and best supporting your body to get rid of toxins is going to be the number one thing that I can recommend right now. Oh, thank you guys for all the kind words. That's so nice. Randall, Deb, and Pamela, thank you. Shirt and Leslie, thank you guys. Alice, you enjoyed the class. Good. Vita, you are very welcome. Let's see here. Do we have any
It
questions?
says, Mary Sharon, what do you think is the best way to engage chiros in my area?
Perfect. So when you are going to different chiropractors, I would say first and foremost, making sure that you are as transparent as possible when you walk through that door, because some chiropractors only do certain kinds of adjusting. So, of course, I'm always going to recommend going to see your chiropractor, whatever chiropractor is in the area, and even call ahead and say, hey, do you offer consultations as far as nutrition? Do you have doTERRA products? Do you do manual style adjustments, or, do you do muscle work? These are all going to be really great questions to figure out if it's a good fit for you and where you're comfortable. Sometimes I also like to ask, how long is a new patient appointment? I myself, before I was even a student in chiropractic school, one of my favorite things is that I didn't feel like I was just a number. I wanted to make sure that I got to tell my story so that my doctor knew all about me, what my body was like. So for me, I would look for someone that's going to sit down and talk with you for more than just kind of a 10 to 15 minute appointment. But looking at what you'd be comfortable with. Does drinking water from a hydro bottle help inflammation? So when you are talking about good quality things to drink water out of, I would look for stainless steel. So Hydro Flask is typically going to be stainless steel. I would drink out of glass, making sure that you're avoiding plastics as much as possible, because all of those plastics are going to leach into whatever you are eating or drinking. With that being said as well, again, we can't control absolutely everything. So making sure that we can control what we can. So that's going to kind of bring me into also glass containers for food, all of that. You want to make sure that you're avoiding plastics as much as possible and choosing stainless steel and glass. And then I think that this might be more for you. My name hasn't been on the class. Oh, there's some instruction there. Okay, perfect. Let's see. Stephanie said, I'm in month 2 of the 90-day, have a bad left hip, waiting to see a specialist. My doctor said I will eventually need a hip replacement. I'm 58, decent shape. What supplements should I continue taking to improve naturally? So I'd be really interested to know if you had a second opinion into wondering why they think that you need a hip replacement. Is it due to estrogens? Hips and shoulders, when women are going through menopause, whether it's right before menopause or after, there's a huge imbalance in estrogens, and you have a lot of estrogen receptors that are in your shoulder and in your hips. So oftentimes we see hip pain and shoulder pain pop out of nowhere. And then all of a sudden people are being recommended all these different surgeries, when really, again, it's identifying what the issue is. So depending on what the past history is there, I may recommend more hormone testing, actually, both the blood and the Dutch test that we talked about a little bit. Supplements that you could look into. If it's something with, I always recommend, again, getting tested to see which ones are going to be best. But things like the frankincense could be great. Turmeric is wonderful. It's going to be one of our most potent anti-inflammatories. From a wellness way standpoint, there's a lot of different ones, again, recommending testing. The copaiba could be wonderful. Deep Blue could be wonderful. It just kind of depends on what it is that you've tried in the past and looking to figure out what works absolutely best for your body. But that may be more of a topical situation, but I would be really interested to look at some testing for you. Sarah, Dr. Alex, can you speak to what oils are good for histamine intolerance and MCAs? So as far as, let's see here, it looks like Kayla gave some good response for you. As far as the oils, are there any additional ones that you would recommend, Sandy or Kayla, for histamine intolerance?
You know who's on here as well is Dr. Lynn. Dr. Lynn, do you want to comment on that as well? Good for histamine intolerance?
And to give you a second there too, so histamine response as far as, so different things that are really great for histamine response would be, we have things like Albizia and nettle. Again, the Albizia, the actual foundation of what they made Benadryl with was based off of Albizia. So that's why it's going to be really, really great for food allergy response, histamine response there. Nettle is great for a histamine response with IgE or that instant anaphylactic food allergy. Lavender is going to be really a great for histamine response, I believe, as well. Those are some really good options off the top of my head. But again, it depends on kind of the histamine that you are talking about specifically, if there's something more direct. But as far as other essential oils, that's definitely a great question. So I'm interested in that as well. Okay, Susan said, I had the hip replaced, and when they did the block, they damaged the L4 nerve that serves the bladder, so I'm dealing with bladder pain with filling in incontinence. How can I repair damaged nerves? So if it's something where they've already physically damaged the nerve itself, sometimes we can't get full function back in that nerve, unfortunately, which is why typically, as much as we can avoid getting to that point, but there's still some great ways that, this is real life though. This is, you are dealing with this issue. You have nerve inflammation. So we need to figure out again, yes, how do we support the nervous system when you are dealing with damaged nerves? Things that I think about when I'm talking about nervous system inflammation, again, turmeric is a great overall option potentially, but there's also things like Bacopa that could be great for nervous system inflammation. But again, that would all be dependent on testing to see really where that function is. And I'd like to see some muscle testing and nerve testing to see how far of an extent is that damage. Do you still have function there? Do you still have light sensation? Are you still able to have full motor control there? Bladder pain is also, there's a lot of different adjustments that chiropractors can do and to support where the nerve to the bladder at L4 actually comes out. If they damage that nerve, then what you can also do is think about finding someone that will do ART or manual therapy or muscle work to reduce muscle inflammation so that there's as reduced amount of inflammation in that area as possible. How to contact Dr. Alex. So you can reach out to our office. Our office's phone number is 651-330-9453. You can also email, which it was in the slides as well, which it's my understanding that you guys will get a copy of those slides. I believe it said tomorrow.
The recording will be available on Friday. And it'll be on the recording again, yeah.
Okay, perfect. In the meantime, if you didn't want to wait until then, our email is woodbury@thewellnessway.com. So Woodbury is WOOD as in dog, B as in boy, URY @thewellnessway.com. And one of our doctor assistants would go ahead and reach out to you and answer any questions or get you scheduled either for a free 10-minute discovery call where we can chat a little bit more or for that $99 discounted price. All right, let's see here. What are good foods and oils and supplements to detox glyphosate, also heavy metals and parasites? So this is something where I myself am always going to recommend testing. I don't recommend doing any sort of necessarily parasite detoxes or cleanses until you're sure that there's a parasite present. So that's going to be in that Genova stool test as well. That gut test will test for different parasites. But there are going to be some very powerful supplements that we offer that would be able to address that. But a no sugar diet is going to go a really long way. Supporting liver is going to go a really long way. Supporting kidneys, avoiding food allergies and immune system triggers, that way. So those are going to be the best things that I can recommend just kind of off the bat, but always recommending testing first. Do you offer glycerol tonics for those that can't have ethanol? So glycerol is going to be more of a corn derivative in most cases, and we have a lot of corn allergies. So I don't believe, so I'd have to double check. But what we do is if you can't tolerate the alcohol that's in there, then what we would do is we would offer you alternatives on how to really steep out the alcohol. And you can also leave them out so that that alcohol can evaporate. So there are a lot of tips and tricks that we do for our patients. We do offer some that are in capsuled forms, but they're not quite as potent because they don't get into the bloodstream right away. But that tincture, you need that alcohol to extract to get the strongest potency and to make sure that there's no cross-contamination with any other allergies as well. Are you able to do testing for us in New Zealand? We can. So that's something where that would be an international call with Dr. Jen. That is available online as an option. There is going to be a little bit more hoops to go through, but it's definitely something where we can talk about it, set up a Zoom call with Dr. Jen and make sure that we answer those questions for you on how to go through those steps, because internationally there are a couple more restrictions that we have to go through. But we also do have other international locations. But again, with that doTERRA support, I can't speak to on if they have that doTERRA background to make sure that you have as much support as possible. Let's see it. How about copper cups? So any sort of copper, I don't necessarily ever recommend it because I don't know what people's heavy metals are like, and it's not often that people are looking to test their heavy metals, quite honestly. So I would always recommend testing first because, like I said, heavy metals, they can have a huge thyroid impact, an immune system response. Autoimmune conditions right now are at an all-time high. So putting any extra stress without knowing, without testing, I would stick to glass and I would stick to stainless steel. I mean, how to get them. So Mary said to consider utilizing doTERRA in their practice. So I think that one of the best things that you can do, Mary, is when you're trying to work with chiropractors, it's going to be just being honest, open about that communication, seeing if they have other products outside of just their hands as far as adjusting. Do they offer different supplements? Does it seem like they're open to talking about food, about talking to the importance of supplements, about how to, have a more natural realm? If they're offering if they're offering any conjunction with medical doctors, it's something I always think it's open for conversation. So why not just ask? Sometimes people, though, when they are working directly with medical doctors, that's where you'll find a little bit of pushback. But I think education goes a long way. And so if you are able to talk to a chiropractor and they're willing to, one, learn about it, it's worth a conversation. But two, just seeing what else that they have in their office as well.
Kayla put all your contact information in there on Dr. Alex as far as the email, website, phone number in there as well. And I'm not sure, but I think that might be it. Katrina is going to put the recipe that she has in Discovery Essentials for histamine. So thank you for that.
Yeah, absolutely. Let's see here. I'll put it at the bottom. All right. Did we have any other questions? I don't see any others.
I don't think so either.
The specialist response. Yeah, like I said, also I saw that she's going to a specialist. I do think, like I said, not anti-medicine. There's a time and a place, and if you need it, you need it. And that's going to be when, if you do have to go in for another surgery, or if you do have to see a medical doctor, supporting that process of, addressing inflammation is just going to be really important in conjunction with that so that you have the absolute best outcome possible.